First, patient is asked to clench his fist. Now, pressure is applied over both ulnar and radial arteries to occlude the circulation. When the hand is opened, it appears clenched and pallor is noted over fingernails. Then ulnar pressure is released while the radial pressure is still maintained. Look here, as soon as the pressure is released, the normal color of the hand returns. This part of the video is repeated so that you can appreciate the difference. If the hand flushes within 5 to 15 seconds, then the test is called positive, which means the ulnar artery has good blood flow. Failure to flush within 5 to 15 seconds implies that the test is negative and ulnar artery has compromised blood flow. Before any procedure that disrupt or may disrupt circulation through radial artery, we should always check collateral circulation through ulnar artery by this test, like radial forearm free flap harvesting, radial artery cannulation, before CABG, which uses radial artery as graft. If it is called modified Allen's test, then what is the Allen's test? Actually, the original test was described by Allen in 1942. Then it was modified in 1952. In original Allen's test, both hands were tested at the same time. But in modified Allen's test, one hand is examined at a time, then it is repeated on the other side if needed. There is another test which is known as Barbeau test. In this test, the same procedure is carried out with the help of a pulse oximeter. Thank you for watching. Goodbye.